Hello, my name is Dr. Pat Doro, and I am your local dentist. I've been in private practice here in Manhattan for over 18 years. And tonight, this is going to be a live call-in show. Now, all day long, everywhere I looked throughout the city, all I kept seeing was green, 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 green. I couldn't figure out everything I chose to wear tonight was green. Could it be because today was the St. Patrick's Day parade? Yes, this is Saturday night and it's live. That means in a little while I'm going to put the phone number up, and if you're just about to go out and celebrate your St. Patrick's Day evening, you're probably getting ready, you're probably going to get rid of all the goodies that you've been doing today. And if you have any questions about your dental health, about your oral health, please give us a call. You'll see the theme of the show tonight is going to be things that are green. I mean, I noticed when I started picking props out for tonight's show, I kept choosing things that were green. And besides, St. Patrick's Day is my name day. And so all day long, everybody's been calling me Patty. And if you're going to call up, you can address me as Patty too, for the season. Now the first thing I want to talk, I'll put the phone number up now, in fact, at 247-8090. And if you have any questions about dentistry, about oral health, or about anything that I'm talking about tonight, please give a call. Okay, now one of the things that patients have been talking to me about over the last week was a show that was on 2020 last week with Barbara Walters and Hughes Downs. And a few patients quite a few patients brought the tape in because I wasn't home to see the show. And what they were talking about was about the $1.5 billion market for toothpaste sales. And they were trying to say pretty much the same things I've been telling you folks out there on the show for the last 15 years, all about toothpaste. Basically, since it's a 1.5 billion market, all the toothpaste companies have been doing their darndest to get you to buy their particular brand. And I'd like to go over some of those things tonight. Now, the first toothpaste that were marketed were early 1900s. And the basic components of those toothpastes were baking soda, uric acid, nitric acid, and then finally the FDA came along and found a lot of those things in those toothpastes were dangerous. So most of the basic formula of toothpaste had a baking soda type of base. But then people get bored of things like that. So in the 30s and 40s, scientists found out that a chemical called chlorophyll was also a bad breath deodorant. And then people know, they've seen this, it's been on the market since then, something called chlorettes. And basically they use chlorophyll in their gum to sweeten your breath, because chlorophyll was like a natural deodorant. Now one of the major toothpaste companies, in fact it's number 2 in the country, is Colgate. And the reason I chose Colgate tonight, because I'm going to show you how Colgate has marketed their products from the early 1900s to today for you, the consumer, to pick up their product instead of some other product. Now Colgate took that, not only put the chlorophyll in their toothpaste, but they came up with a brilliant idea. Why don't we have people wash with chlorophyll? And they came up with a soap called Peter Pan soap. The big show on Broadway back in the 30s and 40s was Peter Pan. And since Peter Pan was green and chlorophyll is green, they marketed this soap. And you can see, again, keeping in with the fact that it's St. Patrick's Day, you can see how green the soap was. And the reason I have soap like this is because this product bombed on the market. And the reason it bombed is because it didn't foam, and it also sank in the bathtub. The same product, at the same time this was on the market, Ivory came up with their soap that was floating on the surface in the bathtub. This stuff would sink. Not only would it sink, but it always left a dark green film around, and people didn't feel like they were really getting themselves clean. So my grandfather, back in the 30s, offered Colgate a lot of money, and he bought their entire stock of this Peter Pan soap. So I pretty much grew up on this soap. And with the chlorophyll, and of course it's very nice, but you got to get used to the fact that a lot of products that came out, that Colgate has come out with, have bombed over the years. I think I'm the only person that possesses any more of this Peter Pan soap. It is a very good cleansing, but it wasn't appealing to the consumers. So Colgate learned a very important lesson. All these soaps that came out after that floated and foamed, and they were white and clean looking. They never came back with another dark colored soap like this again. So when it came to their toothpaste, because the chlorophyll toothpaste didn't do so great on the market, the next thing they put into their toothpaste was something called fluoride. And that was back in the 50s. Fluoride was thrown into the toothpaste. And so they came up with their fluoride toothpaste. And every toothpaste that put fluoride in it got the American Dental Association approval. And this is the Colgate. And to make it even more interesting, they came up with a wintergreen gel to make the fluoride taste more interesting. So again, people would pick up this product because gel was different than a paste. And even for the children, who we always recommend get a fluoride toothpaste to, they came up with Colgate Junior, which not only had fluoride in it, but it sparkled. And again, a child would use this much more often. And of course, mom and dad would buy it much more often. So fluoride lasted us all through the 50s. Now they needed another thing to add to their toothpaste to get people to buy them. And so the next thing that they came up with back in the 60s was that they found out since they put fluoride in the toothpaste, people's teeth were lasting longer and people were developing sensitive teeth. So they came up with sensitive teeth toothpaste. And again, oh dear, I don't have my sensitive teeth. Well, they came with the sensitive teeth toothpaste, and that was a big seller. Even today, we see sensitive teeth toothpaste on the market. Okay, the next thing that happened was in the 70s, we ended up going back to the baking soda again because people wanted more natural cleansing in their mouth. And not only that, but dentists were finding out that a lot of the toothpaste had all these additives in it that people were a little bit too abrasive. So again, Colgate went back and they said, you know, we're going to go back to the 1900s. We're going to come up with baking soda type toothpaste. And they came out with great tasting baking soda with a natural mint flavor. And you can see the words natural written all over the place, and it fights plaque, and it's great tasting. So again, this was one of the #1 sellers back in the 70s when baking soda became very popular again. Dentists were recommending patients to go back to baking soda because the other toothpaste tended to be very abrasive. Plus they had the fluoride in it, which again was very beneficial. So some people, again, they said they want something a little bit different, so Colgate came out with their baking soda gel. And the problem with adding baking soda to the gel and to the paste, you weren't really getting a baking soda type of effect, because as soon as you put it into a gel form or a paste form, the effects of polishing that baking soda does was really not working. But it didn't matter. People felt like they were brushing their teeth and they were purchasing these products. Okay, so again, that went on all through the 70s. And then finally, the scientists came up with a new gimmick. They say, well, you go to your dentist, he scrapes your teeth, and he says, boy, you have a lot of tartar. So Colgate got smart. They developed a chemical that actually does control tartar. And they started marketing their tartar control. So after the dentist says you have a lot of tartar, you go to the drugstore, you see tartar control. And so the consumer, you pick up this product because you feel that it's going to make your dental visits easier. Now there's a very important part about tartar control is yes, there is a chemical in there that does control tartar. But #1, you have to go to the dentist first and have your teeth squeaky clean. What this does, it reduces the formation of tartar. It doesn't remove tartar. So if you see tartar control in any of these products, don't expect it to remove the tartar. You have to go to the dentist for that. And not only that, but this decreases the formation of tartar above the gum line. The most dangerous tartar is the one we're worried about, is the tartar that's below the gum line. Oh, we have a phone call? Hi, you have a question?
Yeah, hi, doctor. I'm curious about mouthwashes.
Yes.
Are they any good? I mean, do they really serve any purpose?
Yes.
And if so, which ones do you think are say, the better ones? Or
Okay. Thank you for your question. That's a good point, because I know a lot of you have been out drinking today. You know, you can't help it, all that green beer running around and celebrating St. Patty's Day. It was a lovely day out today, a little bit chilly, so I saw a lot of people had little green flasks that they were drinking out of too. So right now, a lot of people think they have a very bad breath. So I know what you're going to do. You're going to rush home and you're going to grab, you're too busy to brush your teeth, so you think you're going to grab some mouthwash, rinse your mouth with it, and your mouth is going to taste gorgeous and you won't have that bad breath that comes with drinking too much. That's not true. Right now, we do not recommend mouthwashes unless there's a medicinal purpose for it. As we find that mouthwashes, especially, this is recent data, mouthwashes have a lot of alcohol in them. And what alcohol does, it dries up the tissues even more, giving you a worse bad breath. Just for a few minutes, you might have a taste in your mouth after the alcohol evaporates and it leaves the oils or the taste behind. But 5 minutes later, you are exuding not only that same bad breath, but you're also exerting more bad breath because the alcohol is drying your tissues even more. So if you're going to choose a mouthwash, something like Plax, I do not recommend, and dentists don't recommend, because, again, not only besides alcohol, it's got a lot of chemicals in it. And it really doesn't do much to help your breath or to help your teeth. The only time we ever recommend something like this is for people who really can't floss or brush because they have bad arthritis or they're infirmed. This is better than not brushing and flossing at all, but still it's not efficient. And it has a lot of alcohol in it. The other alcohol mouthwashes that are on the market, and this one has been in the news lately, it says Cool Mint, but it looks kind of blue. Again, I was trying to keep the green going here. Cool Mint Listerine, they found that there's so much alcohol in this that it is causing an increase in oral cancers because people who drink a lot plus use a lot of this alcohol mouthwash, they do get a higher incidence of cancer. That's just too much alcohol for the mouth. So if you're going to use a mouthwash, if you really want to use a mouthwash, you should choose a mouthwash that is alcohol-free. And the first one I saw on the market many, many years ago was an old company. My European patients bring this in because it's very popular in Europe. It's called Merfloran. And they were all natural and, again, no alcohol. And you can usually get these at health food stores, but I see now there are more and more drugstores you can get this. And, of course, then there's always Rembrandt came up with their natural mint flavored and alcohol-free. And there's also Clear Choice. Again, alcohol-free mouthwashes. But again, these aren't going to do too much for you. And what worries me about these type of products, there's a lot of chemicals in them, and they haven't been on the market too long. And I'm afraid what those chemicals are going to do to your mouth. Thank you for your question. We have on, it's the top or the bottom line? On the bottom? Whoops. Hello, you have a question?
Yes, good evening, Dr. Doro?
Yes.
Okay. What happened is I wore braces.
Mm-hmm.
The braces have been off.
Right.
I didn't wear my retainer as long as I should have. I know. I'm looking at your face right now, being depression. What I'd like to know is, should I go back to my orthodontist, and will he make me wear braces or just adjust the retainer? And do tell me more about what mouthwash to use, because I just tuned in to you and got through.
Okay.
Okay,
Okay,
thanks.
thank you for your question. Okay, what she's talking about, after you have your braces taken off, the teeth still have a memory of where they used to be in your mouth, and they kind of want to go back to that spot. So what we want to do is maintain the teeth in the position we had them when we take all those wires and bands and everything off, and let the bone get used to those teeth being in that position and strengthen and hold the teeth in that position. So what we do is we make you wear a retainer, usually at night, a few hours at night, and probably 3 to 6 months. Some patients wear it for, it was a lot of movement, for a year. And so the teeth get used to that new position. Now, she lost a retainer or she didn't stop wearing it, so her teeth are starting to move backwards. Now, what I'm finding, a lot of patients are like that. Usually, I can just give another retainer and just do some minor movement. And a retainer is something you can take out of your mouth when you don't want people to know you're wearing braces. So a lot of the minor movements we do in orthodontia, which it sounds like this woman needs, would be done by a retainer. You can go to a general dentist to do that, because a lot of us are doing that. Or you really, if you want to do it right, go back to your orthodontist, because he does have your models and he knows your mouth. And he could probably do a faster job for you because he knows you already. So yes, please get back to the orthodontist and have him correct that, because it's probably not wearing heavy-duty braces anymore. It's probably just minor tooth movement with a removable appliance. Now, in terms of mouthwashes, again, the only mouthwashes that dentists do recommend are by prescription. And one of them is Paradex. It's been the only one on the market for quite a few years, and it was chlorhexidine. But there were a lot of side effects with that mouthwash. It did kill the germs, but it did have side effects. And one of the side effects, it had a bad aftertaste. The second side effect, it tended to make your teeth and your fillings dark. But it was only a temporary darkness. You come to the dentist, you had to come to us to remove those stains. And it turned your tongue black. Some people didn't like that. And it was very, very expensive because they're the only ones that had that patent. So in recent years, more and more dentists are going back to an old product. and we started using fluoride. So there's another prescription mouthwash that I've been recommending in my office, and a lot of doctors are recommending, and it's called Periomed, and it's using fluoride as its gum protectorant. It's actually gum medicine. Not using fluoride actually to stop cavities in your teeth, but fluoride is now being used to stop gum disease. And again, it clings to the gums, and unlike the other mouthwashes that have alcohol in it, and the mouthwashes like Paradex, which was chlorhexidine, it doesn't sting when you use it. So a lot of patients prefer that soothing effect, and it clings all night long to their gums, so the antibacterial effect works all night long. And I even have patients who soak their dentures in it, so their dentures are sweet tasting in the morning. It kills the germs that cause bad breath for real. But you have to go to your dentist to request that. And if anybody wants any information, I will send it to you if you call or write my office after the show, and you can take that to your dentist and he can get you a prescription for that. Okay, thank you for your question. We have another phone call. Hi, you have a question?
Yeah, hi, how you doing?
Okay.
I'm just wondering, I just had like an icicle pop, and the teeth, I had like a very bad...
Ouch, pain?
Does that necessarily mean that I might have cavities or some kind of damage?
Where is the pain? Is it in the front? It is...
Yeah, in the gums above the teeth.
Right. Okay, thank you for your question. Okay, because we put fluoride in the water, kids aren't getting cavities, and all those kids are now grown-up baby boomers. And so the number one problem we're fighting now is called sensitive teeth, and that's what he's talking about now. And basically, here is a diagram of sensitive teeth. Actually, you know what? I'll show you a better diagram. Sensitive teeth means that the part of the tooth that was normally covered and protected by the gum has slipped down, or this person is becoming long in the tooth. And it slips down because either you don't have 100% good oral hygiene, or with age, you know, everything drops, you know, if you don't work it out, if you don't take care of your teeth. And the other thing is, I'm finding patients are brushing so hard their teeth with hard toothbrushes or with harsh toothpaste that they're literally scrubbing their gums away, exposing this part of the tooth that does have nerves in it. And basically, every time you drink something cold, and sometimes even sugar, when it hits this area of the tooth that used to be protected with gum, it gives a sharp sensation of pain. No, it's not a cavity if it goes away in a few seconds. That's just sensitive teeth. And here's a diagram of what it looks like. This patient had perfect oral hygiene. I mean, they never had any cavities, they never had gum disease, but what he did in his zeal, because he was also a weightlifter, what he did was he brushed so hard that he brushed away at the whole gum. You see how long his teeth are? And you can see this darkness. That's actually the nerve is almost sticking out of these teeth, because in his zeal he brushed it away. This part is called dentin, this part is called enamel. This is very hard, the top part of the tooth, but the part that used to be covered with gum is very soft, so it's very easy to scrub this away with your toothbrush. If you look on the bottom photograph, scrub it away. What I did here, because it was not only, it wasn't because of the pain, we got rid of the pain, it was just a cosmetic reason. He's on television. We had to cover up these spots. We usually don't. We just instruct the patients how to brush their teeth. So what I did is I put porcelain laminates there. So now when he scrubs his teeth, which, you know, we try to instruct him not to do that, but every once in a while he's going to go in there and scrub them. He's going to scrub the porcelain, and he won't scrub away all that area. Plus, you can see aesthetically, the teeth look a lot more natural and normal looking now. So we don't really advise people to cover up those spots, because it's not a cavity, and we have to drill a hole in there to cover the spot up. We might stimulate the teeth even more. Unless it's an aesthetic problem, we tend to leave them alone, and what we recommend you use are sensitive teeth toothpaste. Okay, let's go with the green theme again, like Sensodyne with their cool mint flavor. We have Aquafresh, had their Aquafresh sensitive teeth toothpaste. Let's see. Then we also have Rembrandt. It's not green, but Rembrandt sensitive. Okay, now this says Rembrandt sensitive teeth to whiten your teeth. You're going to pay a big premium for this toothpaste, because that's the next thing that they're marketing for, is people who want their teeth whiter. They're buying these whitening toothpastes. And according to the American Dental Association, these toothpastes do not whiten your teeth. The best thing that they'll do for you is keep your teeth whiter, but they do not whiten your teeth. You have to have that done professionally at the dentist. So if you do have these sensitive teeth, what you should do is pick up one of these sensitive teeth toothpastes and use them, and you'll see the sensitivity will go away. But you also must change your brushing and flossing. You should start flossing more. Don't let all the sensitivity continue as you get along. And tell your dentist you have sensitive teeth, and he or she will show you how to avoid having sensitive teeth and probably recommend one of these toothpastes for you. Okay, thank you for your question. Okay, I was talking about fluoride being used for gums. Well, Colgate, now everybody's got gum problems. Colgate now came up with their gum toothpaste. So this is actually by prescription, and it's using fluoride in it. Okay, because a lot of patients, because that part of the tooth that they brushed away, it is very weak, and sometimes patients do get cavities down there. So you'll see Colgate is now recommending brushing your teeth with fluoride to prevent those cavities. We see some people with certain illnesses do tend to get cavities down there, and the fluoride is highly effective in preventing those cavities. So there's a lot more fluoride in here that you would find in any Colgate toothpaste. So again, this would be a prescription toothpaste that you would get from your dentist, and a dentist would prescribe it to help any situation that you might have that needs this type of toothpaste. So again, we're finding fluoride has a new use here. So the next thing that Colgate did, they said, you know, now we have baking soda. People like baking soda. People like tartar control. So they came up with, why don't we put the two together? And they came up with their tartar control baking soda gel. Okay, so that's pretty much covering a lot of bases here, and so this became a very popular, plus people like this kind of pump idea because it's always upright. You don't have to worry about squeezing every single drop out because it's gravity will bring most of it out. People felt, and I like this much better than pumps because I feel like you're really getting good consumer dollar, you're really getting good a good product for your consumer dollar here. You're really using all the toothpaste. But again, you're paying a premium for the tartar control part of this toothpaste. So do you really need it? Ask your dentist, do I have a tartar problem? Should I purchase a tartar control toothpaste? Do not purchase these and pay that premium unless your dentist says that it will help you and you do have that problem. It's only 10% of the population have a real tartar problem, a medical problem with tartar. Most of us have tartar because it's lack of oral hygiene. So you don't really need this tartar control unless it's specifically a medical problem that you have. Okay? So the next thing that's very popular, and this has been the big market in the 80s, was baking soda and peroxide. So Colgate, Metadent came up with theirs, and Metadent is now #3 selling toothpaste on the market. And it's the most popular because everybody hears about baking soda peroxide. Metadent was the first to put the two together in their pump, but again, it's very, very expensive. So Colgate came up with their baking soda peroxide. And according to the American Dental Association, does the baking soda peroxide really work? Well, there's not enough peroxide nor baking soda in this product to actually be beneficial than using straight baking soda peroxide. But some people like the feeling, they like the taste. If it makes you brush longer and more often, then this is an excellent toothpaste for you to choose. And Colgate is always a very competitively priced company. So choose this Colgate if you want to use that baking soda peroxide. We have another phone call. Hi, you have a question?
Hi, is there an effective way of really curing bad breath completely?
Completely?
Yeah.
Stop eating. Thank you for your question. The major cause of bad breath actually is bad oral hygiene, not brushing or flossing your teeth properly. And the best way to find out if you have a bad breath is when you go to your dentist, ask he or she, Doc, do I have a bad breath? The dentists, we are trained to recognize bad breath because a lot of bad breaths are not only just called for not brushing and flossing your teeth, they're caused by cavities that might be in the mouth. They're caused by sinusitis, by bronchitis. They're caused by diseases like hepatitis and diabetes. And more often today, a lot of the bad breaths we're seeing is because of dry mouth. And people get dry mouth because they're taking sinus medicines, they're taking antihypertensive drugs, they're taking anti-anxiety drugs or antidepressant drugs, they're going under chemotherapy, and all those things do dry up the saliva glands. Yes, the #1 mouthwash that we recommend, we carry around with us all day long, and that's our saliva or spit. That's the best mouthwash in the world. So how do we get it to flow? Well, we recommend that people, if you really want to have a good breath after a meal, you should pick up a piece of gum, because chewing that gum will make that natural mouthwash, your saliva or your spit, start to flow, and it'll start neutralizing any acids. Yes, all the bad breath is usually an acid smell. It will neutralize acid, just the act of chewing the gum. And you can get sugarless gum, you can get regular gum. It's just the idea of chewing. There isn't any chemical in these gums. You'll see how they're advertised to fight bad breath and fight cavities. It's just the idea of chewing. And you know, for kids too, after you give your kids raisins or anything like that, give the kid a lollipop that looks like this. This is a blow pop that after you eat the sugar on the outside, in the inside there's gum. So the chewing of the gum will actually wash away all the sugar that is on the child's teeth, and the gum will also pull the sugar off the child's teeth. So if you want to go for lollipops, go for something with the gum in the middle, or after you eat something sugary or sweet or anything, chew a piece of gum, and it's almost like natural mouthwash in your mouth. So is there a cure for bad breath? Make sure you find out what's the reason of your bad breath, and then the dentist will tell you that and also show you how to take care of that particular bad breath. So thank you for your question. So the newest thing in the 90s, you'll see all the toothpaste they're marketing to now is something called whitening toothpaste. And there was Effie Smile, and then there was Super Smile, and Rembrandt had their brand, and of course Colgate said, hey, wait a second, you know, there's a market out there. Everybody's asking for whitening toothpaste. So they're platinum toothpaste. Now there's something that's very absent on this tube of whitening toothpaste. There is no longer the American Dental Association seal, because the American Dental Association do not approve of these whitening toothpaste, because they said really don't whiten your teeth. They keep your teeth whiter though, because because they do tend to make your teeth a little bit smoother. But there's not enough whitening ingredients, and they don't stay in your teeth long enough for these whitening toothpaste to use. So again, you see Colgate, I have at least 25 different toothpastes that Colgate has on the market right now for different audiences, for different problems. Before you pay the premium on some of these toothpastes, ask your dentist, hygienist, do I need these particular products? Will they work for me? Because basically all you really need is the toothbrush and the floss. And that will help take care of your bad breath. It'll fight your cavities. Colgate has a wonderful variety of toothbrushes on the market, all different names. I mean, we can go into a whole 3 shows on toothbrushes alone. Always look for soft when you're looking at toothbrushes. Colgate Plus, Colgate Angles, Colgate Super Soft, Colgate Precision, Colgate Psychedelics. You know, so you can always choose a toothpaste, but look for the words S-O-F-T, and always remember, this is the most important thing Colgate makes, remember to floss, 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 floss. So happy St. Patrick's Day to everybody. I think I kept in with the green here. I'll see you in a couple weeks, and if you have any questions, call or write my office, and I'll send you information on everything I talked about. Good night, everybody. Don't drink too much tonight.